So thanks everyone for joining us this morning. We have some sad news to share with you. Dr. Alan Melnick, our Clark County Health Officer, will give you some information, and then Clark County Council Chair Eileen Quiring will have a few comments for you, and then at the end we'll be available to answer a few questions, but please save those for the end. So, Dr. Melnick.
So we unfortunately have some really tragic news to share. Last night, 2 people with COVID-19 died. It's especially tragic. This is a husband and wife, both in their 80s, who were hospitalized at Peace Health last week. One of the patients was a resident at a small adult family home. And I do want to mention that all the staff, since it's a home situation, all the staff and the residents at the adult family home have been quarantined or being monitored actively. They're all considered close contacts. The other patient was a resident at Van Mall, which is an assisted and independent living community. Clark County Public Health has identified and notified all close contacts of that patient, and they are being quarantined and they're being actively monitored. This is really a horrible tragedy, and our thoughts and prayers are with family members. Councilor Klein.
Yes. Well, yes, this is sad news indeed, and our hearts and thoughts and prayers go out to the family of these patients and for those actually who, the others that have tested positive for COVID-19 in Clark County. My message is, please just practice what we have been told about this virus. Wash your hands frequently. Do practice social distancing. And please listen to trusted sources. And our trusted source is the Department of Health and Dr. Melnick. The Department of Health will be updating the Clark County website. It's on the first page of the Clark County website. In the lower left-hand corner, it's red. It says, COVID-19. Click on that and you can get the latest information from the health department. So with that, really our hearts and thoughts and prayers go out to these patients. Did you have anything? Councilor Medvedev, would you like to?
Well, I didn't have any prepared comments. I just echo what the chair just said. This is not a time to fear. This is a time to be pragmatic and follow each and every precaution that's being published by our health department everywhere. So please don't fear. Our prayers do go out to all the families that are affected and those that are worrying, those that have come up positive, those that are worried about coming up positive. Take care of your neighbors, take care of yourself. Social distancing works. It is being effective. Let's follow those precautions, each and every one of them. Thank you.
Yeah, I don't want to give out personal information of these 2 patients, but as we've mentioned in the past, and what's looking at in terms of this particular infection, it not only affects people with comorbidities, but it also affects people who are older. These 2 people were both in their 80s, and just the elderly population is particularly at risk from death from this disease.
Can you tell us, between these 2 people who passed away, you mentioned their close contacts have been identified and they're being quarantined. Can you give us a ballpark of how many people in total that may be?
I don't have the numbers with me right now. In the adult family home, it's only the staff and the other residents, and it's a pretty small number. At Van Mall, the number is not huge, and the reason for that is when we look at close contacts, we're really looking, and we've mentioned this, I think we've mentioned this a few times, that we're looking for folks who really spent more than 10 minutes. We do extensive interviews on this when we're investigating them. We look at people who spent at least 10 minutes within 6 feet of the person with COVID-19, as well as somebody who may have coughed or sneezed on them, or caregivers who may not have used appropriate protective equipment. The numbers are fairly small. This doesn't. We're concerned about. We're really concerned about the close contacts in terms of how this is spread. It's mainly spread through droplets. If I gave you more information, I don't want to really say exactly where this person was in Van Mall, and if I gave you more information about the numbers, it might indicate that. So we did do extensive interviews, and we're really trying to make sure that the close contacts of people really that we're concerned about are protected, or are quarantined, I should say.
Dr. Melnick, have you learned anything more about how this couple contracted coronavirus or COVID-19?
Well, they did have close contact with each other because even though they lived in different facilities, but the bottom line is they contracted it somewhere in the community. I mean, neither one of them traveled. I don't know where they actively, what person or where they contracted it, but I am confident that they contracted it within Clark County, not from traveling. And that's why we're saying it's out there, it's here in our community.
So the husband and wife, that they lived in different facilities, but they had contact with each other?
Correct, yes, they did have contact with each other. Not that, nobody that I know of that were close contacts or were quarantined has yet developed symptoms, and we haven't, so nobody has yet been tested.
When were they hospitalized?
Oh, boy, it was sometime last week. I'm sorry, I'm losing track of the time, but yeah, today is Tuesday, it was early last week. As soon as the laboratory tests are, respiratory illness, including severe respiratory illness, is really common at this time of the year. So we began the investigation as soon as we have lab confirmation that this is COVID-19. That was last week sometime, I believe.
Did either of them have any underlying medical issues, being in their 80s?
Yeah, that was asked a minute ago, and I don't want to give that information out because I really don't want to violate any privacy. I will say that just being in your 80s itself, in terms of this illness, is a risk factor.
Can you talk a little bit about, some states have decided to release specific ages, others saying general ages, others saying ranges from, 60 to 75. Why are so many different public health doing that?
That's a great question. I'll tell you what we consider. We consider numbers. So, right now we've had 4 cases. So if I listed ages, it might be identifiable because we've only had 4 cases. I hope we don't get there, but if we had thousands of cases in Clark County, I'd be much more likely to release specific ages. It's a matter of privacy. The smaller in public health we use the word N, the smaller the number gets, the less we want to release. It isn't just about COVID-19, it's about any kind of, we did the same thing with measles. I think you might remember that.
How are the other 2 cases doing? What can you tell us?
One case is still hospitalized, and the other case was not hospitalized at all, but is isolated at home.
And is the difference in that just based on the symptoms they're showing, age range, underlying conditions, all of the above?
I'm sorry, they would both be isolated because they're COVID-19. I'm not sure I understand what you're asking.
One being in the hospital and one just being isolated at home.
The one that's being isolated at home was not sick enough to be hospitalized.
Have you been able to talk to the family of this couple that passed away at a time where we can't really hold maybe a memorial service, a public gathering? How tough is that right now?
Yeah, that's one of the things that's really tragic. I haven't spoken to the family about this. I know that they received really good care at Peace Health, and I'm sure their caregivers have spent time talking to the family about this. Yeah, but one of the tragedies about this is I couldn't imagine what the family's going through. I mean, it's tough enough to lose both your parents at one time. I can't imagine that. Plus, there's restrictions on public gatherings right now, and it's got to be incredibly difficult for them. I don't know if I have better answer for that than that. It's just horrible. Yeah, I don't want to get in front. I think I recommend that you talk to Peace Health about that so they can answer that question. I know that the care was compassionate and done really well, but I don't want to get ahead of Peace Health in terms of having them answer that question.
Doctor, for people who live in Clark County and are hearing this today and have no contact with either of these facilities, does this change your guidance for them?
Great question. The guidance is still the same. I think one of the points I want to make, well, first of all, there's been a lot more restrictions in terms of social distancing that we don't have a choice about right now. But there's a lot of things that you can do for yourself to protect yourself from getting this infection. This is spread primarily by droplets, so it requires close contact. The things that we've been mentioning that folks should do in terms of, besides distancing themselves, is, wash your hands frequently. Soap and water is the best. If you don't have soap and water available, hand sanitizer. Avoid touching your nose and mouth. If you certainly touch an object in a public place, only use hand sanitizer, soap and water after this. Stay home. Folks who are having symptoms, respiratory symptoms are common at this time of year. Stay home if you have respiratory symptoms, and cover your cough. So there's a lot you can do, and this is a lot that we can all do to protect ourselves. Besides the social distancing, if any of us have symptoms, we can't all be tested. Stay home if you have symptoms. Yes, one of them lived at Van Mall, which is an assisted and independent living facility, and the other one lived in a small family home. But they were married as a married couple. They've been living separately for some time apart from each other. Yes, and I don't have the exact amount of time, but they did have contact with each other. They're both COVID-19 cases, and the test that's done for COVID-19 is a genetically based test. I'm sure we have enough epidemiology here that these two cases are related to each other. We use a term in public health called epi-linked. They're epidemiologically linked. They both had the same infection at the same time.
The governor has suggested that folks stay out of groups more. Yesterday, the president made a comment, 10 and more, citing the CDC. What should our guidelines be? That's a big difference.
Okay. So the guidelines that the governor set were about 50. I think the Oregon governor said 25. I think aside from and I'm glad that these guidances are going out. I think the message for all of us, unless it's really essential, avoid public gatherings, whatever the size is, whether it's 10 or 25 or 50. The governor here restricted it to 50 or, 50, less than 50. But I think the recommendation is, the recommendation is to spend a little bit more time at home and less time in public settings where other people are around.
Just to reiterate, so you're monitoring people who had close contact with them, but so far no one else has tested positive?
None of the close contacts for these two cases have developed symptoms yet. So we monitor them for 14 days after their last exposure. And if they don't develop symptoms in that time, we're confident that they haven't become infected.
So would they not be tested then unless they have symptoms?
They would be tested if they develop symptoms, correct.
Going back to the regulation or the restrictions that she had mentioned, Chair Choir, I actually have a question for you with regard to small business closures. Can you comment on why the Small Business Administration hasn't listed Clark County as one of the counties that's eligible for disaster funding?
Actually, I can't comment on that because I'm not sure why they have done that. Clark County itself, the council will be ratifying it, but I declared a state of emergency because of this health outbreak on Friday. So it is in effect here in Clark County. I would say to the people of Clark County, order your dinners, order things from various restaurants and things so that we can help our small business owners to maintain while this virus is going on. It's definitely going to be a financial hit. But I know that both the state and the federal government are reaching out to help in financial ways. So that's a very good thing.
Sure. Are you working at all for our small businesses? I mean, in Seattle, in county, 50 some odd small companies have already had to shut their doors for good.
Yes, I'm very concerned for them. It's a small business is very tenuous. At first, you think in a restaurant, for instance, you really feel for those people that are hospitality workers and they're serving. But I've owned a small business before, and I know once you don't have that patronage anymore, man, sometimes you're running on a shoestring. So it's sad for them. This is natural. And so anything that we can do to help them out, we should do. But definitely, I definitely feel for these small businesses. Thanks.
All right, thank you everyone for coming.
Thank you.
You away, that's a negative perception that you're instilling on that young person as an image. Okay? You should be saying, if you're ever in trouble, that's who you need to call.